I now invite Dr. Gagandeep Kawatra to read the biodata for Dr. Jugesh Chatwal. Over to you, Dr. Gagan.
Thank you, Dr. Sanjay. It is indeed an honor and great privilege for me to introduce Professor Jugesh Chatwal, an excellent clinician, medical educator who has made rich contributions to patient care, academic research, and leadership. Dr. Jugesh Chatwal did her undergraduate and postgraduate training at Christian Medical College, Ludhiana. She is a former Philadelphia Fellow. After completing her training, Dr. Jugesh continued to serve as faculty and head of the Department of Pediatrics at CMC Ludhiana. She was the vice principal for postgraduate studies and an integral member of the Department of Medical Education there, serving as resource faculty for the basic and advanced course in medical education, FAMER fellowship program, and other faculty development programs. Ma'am then moved on to Kalpana Chawla Government Medical College, Karnal, and subsequently to the School of Medical Sciences and Research, Sharda University. At both of these institutions, she continued to serve as a resource faculty for medical education programs while leading the Department of Pediatrics. She is a global faculty for the FAMER Institute, Philadelphia. She has been the resource faculty at national and international conferences and has conducted several workshops. She has many publications and textbook chapters to her credit, including the IAP textbook of pediatrics, the IAP textbook of adolescent medicine, Hutchinson's Pediatrics and Hutchinson's Atlas of Pediatrics, Medical Humanities, and thesis writing book. In addition to her excellent clinical work, she has made significant contributions to research and conducted many research projects and clinical trials. On a personal level, I have the privilege of being ma'am's student, colleague, and she's my mentor. I have seen her seamlessly balance her academic research and administrative responsibilities. I know Dr. Chatwal as a very warm and caring person, and I look up to her as a mentor. I'm sure today's session will give us valuable insights of of creating synergy between the roles of a clinician and a medical educator. So over to you, ma'am.
Thank you, Dr. Gagan, for such a wonderful introduction and a very warm one at that. Thank you so much. Dr. Bedi, should I start screen sharing?
Yes, ma'am.
Good evening, everyone. First of all, I would like to thank the
Ma'am,
MEU.
we can't see your screen so far.
You can't?
No, ma'am.
Okay.
Yes, now we can see.
Okay.
You can make it full screen.
Yeah, it's full screen now. Is it visible?
Yes.
Okay. So I would like to thank the MEU group for giving me this prestigious oration and an honor to be part of this Dr. Rita Sood Memorial oration. And the topic that I am going to be talking about is probably close to many of us, especially the clinicians, that is creating synergy between the roles as a clinician and a medical educator. So what we would be covering in the next half an hour or so is try to define the identity or role as a clinician, and also define the identity and role as a medical educator, identify what are the similarities and conflicts, identifying the challenges and barriers on functioning as both, and creating a synergy and a win-win for both identities. So, one of the common perspectives which many of us may have heard while working in the arena of medical education is that education is for educators and we are clinicians. There is no time to indulge in these activities. The medical educators are a different breed. Medical education walas do not have anything else to do, so they do medical education. And also, how does one earn the bread if you are not doing clinical work? And then you hear it is okay for the non-clinical subjects to be involved in medical education. And sadly, medical education has also been called the ugly duckling of the medical world. So I'm sure most of us would not like to agree with that. So let's go ahead and see how we can get rid of this label. In the similar line, Dr. Rita Sood's initial experience was also something somewhat similar when she wanted to be a leadership position in the medical education arena. She was told by her seniors that this is a work which only old retired people do or people who are nearing retirement. You are an active clinical person and you should not get involved in all of this. But we know she believed differently and she went ahead and made a name for herself. Now we have a name for an oration in her name. Okay, so what is a clinician identity and what is a medical educator identity? And first of all, what is identity? What is the identity of a healthcare professional in a medical college? We all have multiple identities in our personal life and social and family. We mother, father, daughter, spouse, friend, etc. So similarly, even in the professional life, we have multiple identities. We could be a clinician, teacher, researcher, and mentor, and how we deal with them is our job. Identity has been defined by Van Lankweld as identity is something I have. It's a self understanding to which one is emotionally attached. I think all of us would agree that we are attached with our identity, but we authored it ourselves. It's a self authored identity. And identity is also something I do in a context. It is not just ordinarily just an identity. It is a presentation of self which is co-constructed between the individual and the social context. So whatever context we are functioning in, there would be an identity connected to that context. So if we are in a social context, if you're in a professional context, we would have an identity related to that. It is a mix of attitudes, values, and beliefs, experiences, vision, and ethical standards, all of them put together. It's a complex social concept, and usually it is co constructed, meaning that people give it to themselves and others. So we don't only give ourselves an identity, we also give identity to the others. And for professional, it is definitely related to the context of the profession. And we are talking about medical profession. It is related to our direct medical profession and also to the specialty that we are in, the area which we are working in, the sphere in which we are active. It's important to note that a strong professional identity enables the professional to adopt specific ways of thinking, acting, and feeling as the internalized characteristics of their profession. So that's how the identity is important. Summarizing it, the professional identity has personal values, attitudes, morals, and beliefs. It comprises that. It also comprises professional ethics and codes of practice and the law or the legal rules and principles. So it's a composite thing which is which forms the professional identity. Looking at the formation of a professional identity, it's an ongoing and a developing process, and it usually starts pretty early. It would, of course, have a baggage of our early life as well, and also the time when we enter the medical school and during our study days. And as we proceed from undergraduate to postgraduate and other areas of work, it keeps on adding to it, and it gradually matures as we accumulate experiences. Interaction and networking with others within our own profession and other professional groups also contributes to the formation of the professional identity. And subject to the kind of experiences that one undergoes, it can change maybe in a positive way or in a negative way or a constructive way or a destructive way. Formation of professional identity, as I said, is a complex process, just like this slide, which is looking very busy. But it is important to note that the professional identity, there are perceptions, there are meanings, there are images and self-knowledge. That is what is there. But there is a lot of things which contribute to this, which lead to this. You can have the self-value, the values, the emotions, the knowledge, the skills, the efficacy, all of that is going to be there. And the individual characteristics definitely contribute significantly, personal and psychological. And at the educational level, the relationships while undergoing education and the experiences, which may be related to the past teaching or the present learning, all of these contribute to the formation of professional identity. There are a lot of interactions which happen and the processes. So there may be interpretation and even reinterpretation, and finally an integration into the identity that may happen. And all of this is going to happen on the stage of the environmental factors, which may be having historical components or sociological component or cultural component. So these all together form it. There would be certain behaviors which would lead to certain actions, and all of this contributes to the professional identity that we acquire. The professional identity helps us in building resilience for our professional life, developing confidence, adopting collaborative leadership styles. That's important because that is a functional leadership style, enhancing personal well being, and it also provides validation and credibility to us as a professional. A well developed professional identity gives us, as I said already, self confidence and a positive attitude. It gives us the ability to make decisions even under stress, increase our work satisfaction, and a sense of achievement and belonging and resilience to bounce back for any bad experiences that we may have. So it is a necessity to have a well developed professional identity. Lately, a lot of work has been going on getting professional identity to be an important learning point for undergraduate as well as postgraduate students, and that is a separate talk altogether, where professional identity and professionalism are being interlaced. So we would leave that for the time being. Inadequate professional identity development leads to certain problems, and it is associated with a low level of commitment to the profession, of course, and to yourself as well, to the person. There would be moral distress and stress. There would be low self-confidence. There would be poor decision-making abilities. And it also affects the educator's confidence to instill appropriate professional knowledge and values in their students. So it doesn't end at the personal itself, it goes on to the next level also. A person who does not have an adequate professional identity is not able to pass on the values and knowledge to their students. The functions of the professional identity are multiple. So whatever the profession may be, whatever the type of professional identity there may be, there would be a philosophy, there would be professional knowledge and skills, there would be professional roles, there would be professional attitude to work and cooperation with colleagues and professional engagement and behaviors. All of these and part and parcel of the professional identity. So when we are looking at a clinical person's identity, the functioning, the roles or the things that they perform would be patient care, patient communication, administration, peer relationships, interpersonal relations. Teaching is an important part of a clinician, whether they want to say they are a teacher or not. They teach patients and their even attendants, the students and allied health professionals at some time or the other. As an educator or a teacher, one is a curriculum developer, test developer, assessor of learning, and a communicator, mentor, educational leader, and educational scholar. So you can see there are so many commonalities between being a clinician and being a teacher. Communication is required. You're dealing with the students. you are teaching the students and many other people. So it is an overlapping kind of a identity. Some of the thoughts which have been expressed by some educators in a qualitative study on being asked how does it feel to be an educator, and on in these focus group discussions, the thoughts or the themes that emerge is that they feel that they are an integral, this professional identity is an integral part of our identity. It's a way of repaying back to the society by achieving a good professional identity and teaching the students. We are molding the future generations of teachers and learners. And also for the person themselves, there is online ongoing learning. There is a certain energizing and gratifying feeling that you get. It has been said that a strong teacher identity enhances teachers' intentions to stay in health professions education, their willingness to invest in faculty development, and to invest in their own professional development as teachers and enjoyment of their teaching role. So that's where the importance of identity when we are talking of developing medical educators, that once you have a good or a strong teacher identity, one is able to go on to the role of a medical educator. And teachers combine, of course, multiple roles. But the problem usually is that developing a strong teacher identity in the context of health profession education is usually challenging. The environment in which the health professionals are working is usually more supportive for identity as a health practitioner or a clinician, or maybe at certain level researcher, but not so much for a teacher. And also, it is influenced by the institutional culture and the networking groups, the institution in which you're working and the people you are networking with. This is a graph or a diagram which has been put by Van Lackwell on a hierarchical identities, which is an important chart. It shows that how the identity metamorphoses into different levels. So at the first level, teaching is seen as a secondary job. Clinician and researcher is the primary job and teacher secondary. And most of the time, the person would come out with a statement like that. I consider myself as a medical practitioner foremost. Even when I'm a teacher, I don't feel like a teacher. I feel more like a medical doctor. So it's important because I studied to be a doctor. So this is usually the initial kind of a identity that people have when they are in the teacher and a clinical researcher mode. Then it can go on to compartmentalized identities where adopting different identities depending upon the context in which they are. So they may be either a teacher or a clinician researcher, but they can switch. So usually the feeling would be I consider myself as a biomedical researcher as well as a teacher. It depends on the context what is prevailing. The next level is the intersecting identity, adopting the unique combination of different identities, which is more homogeneous, where a clinician researcher and overlaps with the teacher, and they say that I would see myself as a clinician teacher. I teach the next generation of physician. It's the combination that makes my work interesting. And then is the merged identity, where different roles are important in all their contexts, and is a more homogeneous kind of an identity, where the person may likely feel that they are a researcher as well as a teacher and a clinician, of course. And I like the connection of doing research and teaching young students. They keep me fresh and offer me new insights with their curious questions. So this merged identity is more functional identity. So, when we are looking at this as a medical educator and a clinician, what are the challenges and barriers when we say that one needs to develop into a merged identity? Already highlighted this part that the environment is more supportive of clinical work and research, which has been well prescribed and supported by various institutions, medical colleges and universities and regulatory bodies. So they would more encourage that kind of an identity. So one has to kind of battle with that. And the time constraints. Very often, the time constraints are the one which are put as a barrier or a challenge when one is trying to develop from or get into a medical educator role. And very often, there may be an institutional hidden curriculum which undermines the educator identity while stressing the clinical work. Usually, the medical educator sometimes may be made to feel as a lack of self-esteem. They may feel marginalized and not valued. And the clinician's frame of mind or perspective may be very different from what a medical educator's perspective is. What are the supportive elements? Once, if you have embedded identity formation or merged the identities, then it is easier. Providing opportunities for development of the professional identity or the medical educator identity, which can be done by incorporating in a longitudinal faculty development program, which helps in a better identity development. There have been studies which have evaluated the faculty who took part in longitudinal faculty development program, and they came up with better commitment to be a medical educator or learning more about faculty development. Networking is important, networking within the group, and building a community of practice which gives them more confidence. Reflections is again another important step. Reflecting on the learning of as a medical educator is important because it gives you confidence, and then a community of practice is also there. Mentorship is definitely essential, and recognition absolutely helps. It leads to status enhancement at a local level and even beyond. So these are important supportive elements for encouraging development of an educator identity. Again, Van Lekwell has come up with this graph which shows the different levels of development as a medical educator, what happens, how the roles evolve over a period of time and a period of training and exposure. At the basic level is an effective teacher who would be just basically teaching effectively. Once they get more exposure to medical education, technology, and related material, they can become skilled and collegial teacher. At the level 3, with more deeper knowledge and experience in medical education and learning also in medical education, there would be institutional leader in teaching and learning, and even a scholarly teacher who's doing scholarly work on publishing. And these then can contribute to the person becoming a national or a global leader in teaching and learning. So this has also been considered as a way of looking at the promotional criteria for saying how the medical education person is progressing. This is a good graphic diagram to show that. Relating to my story and my experience, so being in CMC Ludhiana, I was fortunate to have had early exposure to medical education because one of our principals was very interested in medical education, and then there were visitors regarding the same, and the trainings happening also in medical education. Dr. Tajinder Singh also went for training. So all of this exposure to medical education helped us also get some mindset towards medical education. We were sensitized. And then my FAMER experience in USA helped a lot. It was an immersive exposure and a transformative experience. So from being a self-proclaimed first love of clinical work to being a committed medical educator as well, I had a transformation. But how did I merge the 2 or 3 roles? Because I'm not only a clinician, a medical educator, but also a researcher. So how did I do that? Now that's not an easy thing to answer. There are no specific things that I can say, but definitely there are a few things which help. As I said, there are supportive elements. So constraints are there, plenty. Time at one level, time again for various issues, administrative issues, which can really take away your time, meetings and other things that are happening, and even permissions that may be lacking. Hidden curriculum, already referred to, which focuses only primarily on clinical work. You don't feel valued, you feel unsupported. So all of these constraints are there, and it is easy to leave it and not do it. But there are also supportive elements. How can you get the first time bit that needs to be sorted? By delegating your responsibilities, which you feel that some of the responsibilities which the other people can take on, it is not necessary that you only take all the load and do everything. Learning to say no to some of the things. If you really love the medical education field, you need to say no to some of the things. This is a principle even for other things. So, learning to say no and saying yes to things which you would like to do. And then gradually the support would build as you continue to do that work. And if you're doing good work, you will get the support. And mentors can definitely help. Once you achieve a critical mass of people who are motivated to do the medical education work, then progress can be faster. And the regulatory inputs, fortunately, at the erstwhile MCI, that's about the time the basic training in medical education started off, and the requirement for medical educators to train the faculty happened. And that really did add an impetus to our training. But do not expect miracles. It is hard work. One has to keep on working on it. But once you keep doing that, one would definitely meet success. But why do we so what why do we need to do this? What will happen if we do this? If we don't do this or we do it, what happens? So I can tell you positively what happens. That with my experience of going through the medical education arena, you become a more effective teacher. You also become an efficient learner. You become a better communicator. You grow as a mentor, and a merged professional identity emerges. And that is a personal transformation, and which makes you feel good. And that is a win-win situation where you have your clinical role equally important with your medical educator role. Both are balanced. Moving slightly to the next level from my story. Now, these are the recommendations which has been given by the same group, Vanderbilt, with including Dr. Yvonne Steinert, which was done a lot of work on related to this, on faculty development. What are the recommendations for supporting teacher identity or the medical educator identity? These are the recommendations for the workplace, for the institution, that they should recognize and reward teaching in career frameworks, acknowledge teaching excellence in grants and awards, support a positive message about teaching, take a deliberate and proactive approach to new teacher development, minimize the conflict created by competing demands, ensure that all teachers are provided with the knowledge and skills needed for their specific teaching roles, establish formal or encourage informal teacher networks and communities, encourage teachers to join local or national medical education organization, provide novice teachers with opportunities to observe the senior, more experienced teachers, utilize peer mentoring, and utilize coaching through reflective practice. Fortunately, in the current time, many of these are getting done in some of the institutions, maybe not in all of the institutions, and we are getting a good amount of critical mass. As I said, a lot of people who are interested in medical education. We even have annual conferences, not one, but more than one, on the health professionals' education. So, what are the recommendations for the faculty development? They should encourage storytelling about teaching. I think my presentation is one of those storytelling experiences. Facilitate teachers to reflect on their teaching role, its meaning for them, and their underpinning values, beliefs, and motivation. So these reflections are important. Usually, the faculty development programs, if they can include a reflection session, that would help teachers there. Be sensitive to the context teachers are working in, stimulate the building of social relations and support networks, and establish a longitudinal and continuing approach to teacher development. So, over a period of time, starting only with faculty development, there would be people who would be getting more committed and evolving into medical educators. And finally, at the take home level, where there is a will, there is a way. It's an old saying, and it applies here as well. If you are motivated to do the to enter the medical education arena and develop as a medical educator, you can do it. I hope some of the things that I have highlighted on those can help people who want to spend more time in medical education. After spending years as a clinician, developing a new identity is a complex task. It is understood that, but supportive elements can be enhancing your own skills and knowledge, being informed by theory and research, and engage in collegial activities. The MEU group is one of the collegial activities group. Create and utilize opportunities and seek mentoring, which can help. And forging a merged identity minimizes tension and strengthens each other, meaning both the identities. Thank you. These are the references. Thank you very much. I'll be happy to answer the questions if there are any. Should I stop screen sharing?
Yes, ma'am. Thank you, ma'am. It was a very enlightening talk. And on behalf of the MEU group, we are proud to give you this Rita Sood Memorial Oration. Thank you very much.
Thank you.
The recording is available on the YouTube. I'm sharing the Zoom the link.
Hello.
Uh,
Hello.
yes.
Hello. May I ask question?
No, questions are not part of the oration.
Sanjay, let's have it.
Okay.
Maybe something pressing. Yeah, please go on.
Okay. Please go ahead, sir.
Ma'am, it was a very excellent lecture, and you have give some new idea like identity, teacher identity, research identity. It was a nice presentation. Ma'am, my question is, ma'am, is there any book or any article which can we read to get the more knowledge about the identity of a teacher?
Yes, there are a number of articles now which are available. As I said earlier, that professional identity has become one of the very important aspects of training, and so much so that there are proposals even to include it as part of the Miller's Pyramid as well. But there are a lot of literature now available on how the professional identity develops and how one can enhance the development of the professional identity. You would be able to get them easily on the search.
Recently, in the last 10 years, we have seen very much change in the medical subject. And new terms are we have getting these days from medical education, role of facilitator, role of researchers. And today's lecture is different from our teaching and medical education. And I have learned a lot of things from your presentation. Oh,
Thank
that's why
you.
I'm asking you tell me any book and any articles which we can read and
Maybe, yeah, you could just directly message me or mail me, and I could send you some of the literature that I have.
sure, ma'am,
It won't be
send me
possible
your
to. It
email.
won't be possible to share on this platform.
Uh, Ma'am, send me your email. I will definitely
Okay,
send the
I
email.
will send you. I will send. May I know your name?
My main name is Dr. Rajkumar Bhardwaj from Medical College, Faridkot.
Okay.
Guru Gobind Singh Medical College, Faridkot.
Okay.
I am professor and head department pharmacology.
Pharmacology. Okay. Sure. Sure.
Thank you, ma'am. Thank you.
So, thank you very much. I end the session now.